Hello, Fullertonians. It's been a while. Welcome to another episode of Observing Fullerton. I'm Aruj, an editor and a journalist with the Fullerton Observer. Today, we are interviewing George Searcy, Executive Director of the OC Hope Center. The Hope Center of Orange County, which was established in late 2022, is a multi-city partnership including Fullerton, Buena Park, La Habra, Brea, Placentia, Stanton, La Palma, and Cypress that seeks to establish community-wide coordination and standardization in homeless outreach and engagement. George, thank you for joining us today.
My pleasure.
So I'm just going to get right into it. You have a lot of experience with the city of Irvine, with Jamboree Housing Corporation in Irvine, and Hope Through Housing Foundation. Mm-hmm. So that's the experience you've brought into the Hope Center as well. And I know it's going to be very hard to generalize, but in North Orange County, based on your experience, what do you think the important steps are that we need to take in order to end homelessness?
Well, ending homelessness is, of course, for anybody that's studied it at all, is a multifaceted challenge.
Right.
There is not one solution. But I would say that it requires a coordinated approach by the community, by the nonprofit organizations, and by the resident and business community as well, to understand what the solutions are that have been proven to work. And what we know from all the research evidence about ending homelessness, the best thing you can do to end homelessness is to make sure that there's sufficient housing for the population that lives in the community. When you have less housing that responds to the needs of every segment of the economic strata within the community, all the way from very low incomes to very high incomes, if you don't have that, a particular supply that responds to that need, we know the research says homelessness goes up. And people's perceptions of the quality of life in the community tend to go down. So I would say the first important thing that cities can do is to plan to have enough housing for the population that they currently have. But secondly, when people begin to fall into homelessness, it's important to have some kind of a safety net system. And here in North Orange County, we're really blessed to have a variety of organizations that deal with this, and a group of cities that are very concerned about that. So having outreach programs and shelter beds like we do in Buena Park and Fullerton and Placentia and just on the border of Anaheim is very helpful in that regard to address the situations that you can't avoid when people are in crisis and are at risk of losing or do lose their housing. You need response systems to support them and help them to make sure if they exit to the street, that they get off the street as quickly as possible.
Gotcha. So that's, as far as I understand it, you're saying that the cities need response systems for folks when they're about to go on the streets, and then to get them off the streets, we also need systems built in place. So it seems like the focus here is what the city is doing, or is the focus here what our organizations are doing, or is it a collaborative?
It's a collaborative and coordinated response that's best when it's working well together. When the city and the county government and local residents and the business community and the city councils all agree on what the strategy is to both prevent homelessness and, when it does occur, try to get it addressed as rapidly as possible. And then in the long run, obviously, just getting a person off the street and into a shelter does not end their homelessness, because if you're living in a shelter, you're still homeless. You don't have a home. So what is required at that point is there must be a housing opportunity available so that person can leave the shelter and get into a housing environment or return to a housing environment.
Understood. So let's talk about the affordable housing that is needed. I think in all of the cities you're covering, that's been a topic that comes up a lot in city council. There's organizations working to build more affordable housing, organizations rallying for more.
Yes.
It's a big issue in California and the nation overall. But in North Orange County specifically, what work is being done, what initiatives are being taken to make sure that actually comes to life and we start seeing affordable housing,
Well, it's pretty well documented in the media and in all the literature. And if you ask any city council member or any city manager, building affordable housing is a very complex, expensive task that requires lots of political will and lots of financial capital and resources. So it can take anywhere, once a housing project is identified, it can take anywhere from 4 to 5 years to bring that project, to completion. And during that time, if the community doesn't support it, or if the outreach isn't handled well, the community can object to housing developments that they perceive to be a risk or a threat to their quality of life. So there are tons of balancing issues that have to be handled by every city who wants to do more to have housing appropriate for their population. So I would just say that housing itself is a very complex and sometimes very controversial issue, especially when it's perceived to be affordable housing for very vulnerable populations. So I think every city, the state requires that every city have a housing plan in their general plan. It's called the housing element. And so every city is working on it, I can assure you, but every city approaches it quite differently. So it's not a simple cookie cutter solution.
Right. Let's talk then more about Fullerton specifically, right?
Sure.
What work is Hope Center doing with, say, the City of Fullerton, organizations in Fullerton, to work at this problem?
Well, let me just describe the Hope Center's program model, and then I'll describe how we're working with the City of Fullerton.
Okay.
So there are 8 cities within the northern region that we're working directly with right now to provide street outreach services to them, so that if a person who's experiencing homelessness needs assistance, they can call us. If a city's police department has a need for an outreach to a person experiencing homelessness in their community, they can call us. If a resident like yourself is interested in some assistance for someone you're concerned about in your community, you can call us. And we operate during regular business hours, so 7:15 to 5:15, Monday through Friday, which is the majority of the time that people do call us. I mean, we track when we get calls around the clock, and the vast, over 90% of our calls all come in between 10 and 4. So people call us, and we'll go out, we'll respond with a mobile team, and some of the cities send us police officers that embed with our teams only to support them and ensure their safety. But what the Hope Center does, it will respond to these calls from police officers, police departments, residents, businesses, or persons experiencing homelessness themselves, and we respond to those calls.
Okay.
So I'm sorry, so let me answer the rest of your question, so go ahead and ask it again.
So the question was, how is the Hope Center working with, say, the City of Fullerton or organizations in Fullerton
Great.
to, solve this problem?
Yeah, thank you. So the way I would say we're working with the City of Fullerton is we work very closely with the city staff, and the city sends us an outreach coordinator who is embedded with our team 4 days a week. So he is there to respond to calls when they come in to us. So the city will send us calls. Or, as I said, a variety of people and organizations can call us. Any organization, including the Fullerton Observer, could call us and say, we need some assistance for a person we're observing here, near our office. And we would come out, we would send outreach workers. If the person's willing or interested in getting off the street, we can check right away if there's a shelter bed available for them, and they can get off the street if that's so, and we can help them do that. So we have city staff embedded with our team, and we work very closely with the City of Fullerton, predominantly to respond to calls from the community.
Understood. So say this person is interested in getting off the streets and going to a shelter. So is this a shelter that OC Hope operates, or is it a center that, say, Radiant Futures or Pathways of Hope is operating, or a combination of both?
It could be a combination of any of those. The ones that we most predominantly have access to is the Fullerton shelter run by Illumination Foundation,
Okay.
which is right in Fullerton. But we also have access to the Buena Park shelter, the Placentia shelter, and a shelter called Bridges at Kramer, which is just over the border in Anaheim.
Okay.
So we can place in any of those where there's a bed. And as I'm sure you're aware, shelter beds are in very short supply.
Right.
So any place like Pathways of Hope or a group called His OC runs a family crisis center in Orange, which is a family shelter. So there's a variety of options that we track. And if we can, we utilize the software system that we utilize. When a call comes in, we can actually remotely direct our staff to go out to a particular location. And some of the shelters like Buena Park and Placentia and Fullerton, the Illumination Foundation shelter, all enter their availability of beds in our software every day. So pretty much we have some shelters that like actually list whether or not there's a bed available, and we can check that immediately, and then we try to make contact and get a reservation if the person's interested in getting off the street.
Gotcha. And your staff that is going out from these dispatch calls and
Right.
they're the initial point of contact.
That's right.
Are they trained in some sort of social work, behavioral psychological work, or, what is their background?
Well, they come from a really diverse set of backgrounds, but predominantly what we're looking for when we hire a new person is someone that's experienced in either shelter management or street outreach.
Okay.
So you don't have to have a psychology degree to do this kind of work. It helps to have some kind of a background in human services or psychology or social work. That helps. But sometimes people just have a passion for this kind of work. And I would argue in order to be good at it, you have to understand your boundaries and where the client's needs begin and yours end.
Right.
So it's not about me getting my personal satisfaction from helping someone. It's really more about putting them at the center of my thinking and my strategy in order to do what's best for them. And sometimes, this is no surprise to anyone, it takes a long time to build enough trust with someone who's spent any time on the street at all, because it's very traumatic when you're living on the street. There's a lot of pain and suffering and scary things that happen, especially for women, I'll say. So it's not an easy task to build the trust that's necessary for a person to trust you enough to let you support them going to a shelter. So that's probably the most common misunderstanding when people who try to help someone that they see on the street get off the street. It's like if they're asking for some money, they could be a panhandler, but it can also be true that they just want some resources so they can take care of their own needs.
Right.
Because they've experienced people trying to ostensibly help them, and it hasn't turned out well in every case.
Right.
So it can take a while.
Yeah. So there's that trust factor that needs to be.
There's a
built.
huge trust
Yeah.
factor. So when you're recruiting staff
Yeah.
that can do this kind of work, people who are patient and don't take it personally when people are not appreciative of what you're trying to offer them.
Yeah.
You just have to be persistent and patient, and be able to come back the next time the person has a need. And for every person that we know we're serving on the streets in the northern sphere of Orange County, Fullerton and the other cities, every unduplicated person that we have in our database, on average, we see them every year about 4 times.
Okay.
So that's just the average. You can imagine some people are much higher.
Yeah.
And last year in 2024, we helped about 230 people get off the street, although some of them they exited the street more than once. And some people can't really, on first entrance into a shelter, they struggle to stay, either due to mental health issues or I mean, congregate shelter living is
Right.
not for the faint of heart, I would say. So it's very stressful. It can be very stressful in spite of all the work that the shelter staff put into making it a safe place. But it's not like living in your own bedroom.
Right. Yeah. No, it's very different.
Yeah.
And so do you see this kind of like rotation of people going in and out of the shelter, or are there enough new faces every once in a while? You know, I mean, what's kind of the pattern here?
Yeah. I would say what the data tells us that we work with is that there's not much of a rotation of new people into the region. The population stays pretty static with some, new entrants,
Okay.
some people becoming homeless. But we served about 1,200 unduplicated persons in 2024. And like I said, we see people about 4 times each. Sometimes that's because shelter bed availability is so scarce that you may be asking shelters, can they accommodate George, for example, and it may take 4 or 5 tries before George can actually get a shelter bed. And then if George, who's never been homeless before, goes to a congregate shelter, it can be a shock if that's your first time.
Yeah.
So it's like living in a dorm
Yeah.
with beds and rules and staff all over the place. And how do you shower and how do you toilet yourself? I mean, all of those things you have to grapple with. So it can be a real challenge. So George may not really thrive in his first experience of shelter accommodation. So he may choose to go back to the street and manage for himself. So we try to stay in contact with them. And when they exit, we don't take it personally. We realize that it's a process to get off the street and to end your homelessness. And it just takes time sometimes.
Okay. So, say on average, you're getting turned away from a particular shelter or multiple shelters because there are just no beds.
Yeah.
What is that wait time looking like these days?
Wow, that's a really good question. I'm not sure I have the expertise to answer that particular question. I would say that our data suggests that for every 3 or 4 requests or checks that we make to see if a bed's available for someone, on average, one of those times we'll have a successful placement.
Okay.
So how does that translate into what the actual numbers are? You'd have to look at all of the data from all of the shelters, which is not what we do. I mean,
Right.
we could ask them for that information. Our experience is how often are we able to get someone into a bed after we've asked for one? And they're not trying to game the system. Like literally, there's just every day there's very few beds available.
Of course. So, okay. And another kind of more of a data question that I
Sure,
have
of course.
is how many calls on average, say on a weekly basis and or a monthly basis, is the center receiving?
Well, our calls per day, the middle of the week is higher. I would say our average calls are probably between 40 and 50 Tuesday, Wednesdays, and Thursdays. Mondays and Fridays, they tend to be a little bit lighter.
Okay.
I can tell you for all of 2024, we had about 7,800 phone calls
Wow.
for the year. Now, that's only operating
Yeah.
Monday through Friday.
Yeah.
Now, you can call us and leave a request for assistance outside the hours that we are actually operating. And there's a recording on that message machine that will tell you that we will get back to you. And if you have a need, we will respond to it as a priority as soon as we're back in the office. That would be 7:15 the next business day.
Gotcha.
So if you called in, let's just say tonight at 10 o'clock, you saw someone on the street. You called our dispatch line, which if you go to our website, it's right there on the homepage. We would call you back if you left it at 10 tonight. We would call you back, what is today, Wednesday? So tomorrow's Thursday.
Yeah.
We would call you back right around 7:15 tomorrow morning and say, tell us more. Do you know the person's name? What do they look like? And we would then dispatch a team, if possible, and we would go out and try to find them.
Oh, wow. So it's a very, very quick turnaround for for the calls?
Very quick.
So most of these calls, are you receiving them from folks that are calling for somebody else, or do you also actually get folks that need help themselves, that are your clients calling themselves, you know?
Yeah, it's like about 1/3 to maybe a little more of our calls. Once we connect with you, you can always, George, if he's been served by the Hope Center and we're trying to get him off the street, he can just call the dispatch line himself and the dispatcher will connect him directly with the person that he's working with.
Okay.
Yeah, so it's very seamless, doesn't require remembering a lot of phone numbers. Right. You just call the dispatch line. The dispatcher is there to help you, whether you're a resident, a person on the street, city dispatcher, you know, in the police department, doesn't matter.
Okay.
And that's how I think we've grown to, you know, in 2024, be able to get 7,800 phone calls.
Yeah, that's quite a bit, and that's just in North Orange County, right?
And mostly that's for just the 8 cities that we currently actively are working with. Yeah, so it could, I expect those numbers to grow if possible.
So, if I may ask, all of this data that you guys work with, and see there's reports. I mean, I was trying to look on your website, and there were some monthly newsletters, but unfortunately the links to those were broken, so I couldn't find the actual data. Is there any place that you guys publish them or plan to publish them so people can see what kind of work is being done, what are the numbers, how many people are actually being housed?
Oh, yeah. Well, we're about to publish, and will be posted on our website, our annual report, so that's coming up. And as soon as we have it completed, probably by next week, I'll be happy to send you a copy. And it will be posted on our website. And I'll go back and check those links. We've been refreshing our website, so it may have been out of service.
Yeah, so that definitely happens sometimes.
Yeah.
And I do want to also talk a little bit, since we are talking numbers, about the funding of Hope Center. Is this coming from cities, state grants, donations, combination of all of the above?
Well, the cities that we work with have secured funding from state and federal sources.
Okay.
And then the Hope Center also has a federal grant, so it's mostly coming from state and federal grants.
Gotcha. Yeah. And if I may ask, do you think that that's something that's stable enough to keep you guys in position for a long term, or is it based on just the political state, you know, the situation of the country?
We're looking at the federal situation very closely right now to understand, because obviously our staff are very concerned because the biggest single portion of our funding comes from the federal government.
Yeah.
So that's a concern about its stability. But unless something changes, we definitely see the next 3 years without changes in federal policy, which is always possible given the change in administrations. It's always possible that we will have changes. But right now, we see a pretty clear path for us to have a sustainable operation, at least for the next 3 years. 25, 26, and 27 starts to, then we have to rethink that. But yeah, for right now, we're good.
Okay, so right now there's some stability. That's probably the best news I've heard all week.
Yeah, well, it could change tomorrow, right?
Right, you never know.
Yeah.
So now let's talk a bit more about the center itself. Recently there have been leadership changes at the center, right?
Yeah.
I think you said you came into power as executive director. You were interim director and then became executive director.
I was just filling in
right
while the board was doing a recruitment. Yeah.
So can you talk a little bit about the context of that? You know, what inspired the leadership change? You know, what's kind of the general structure of the center?
Sure. Well, our original executive director was an ex-employee of the city of Fullerton. I believe she was the director of planning. So I think she retired, and the North Orange County Collaborative asked if she would serve as the first executive director of the Hope Center. So she did that, I think, for almost 2 years, and then she departed for other opportunities. I think she's working at Huntington Beach now in her retirement.
Gotcha.
For at least retirement from city life. It seems to me like she's very, very motivated and interested in keeping connected to things. But so the board then decided to do a recruitment and asked me to step in as an interim because I was partially retired myself from the other careers that we were talking about earlier. And so then over time, the board asked me if I'd be interested in the job, and I thought about it and we discussed it. And on January 6th, they appointed me. So I'm the executive director. The Hope Center has a business operations manager that manages all of our bookkeeping, accounting, and all of our business operations. And then we have 7 outreach coordinators that we employ. We have about 6 to 8 outreach coordinators that are shared with us by other cities that we coordinate with. And we have about 4 to 5 different police officers from different departments in the North Orange County city. So we coordinate as many as 18 to 25 different staff, while we really only employ 9 personnel ourselves.
Oh, okay. So just to clarify, do you also run your own shelter, or is it just the center that coordinates?
It's just the dispatch and mobile
Dispatch.
outreach.
Okay.
Yeah, that's all that the Hope Center really does.
Okay, and I mentioned this a little bit earlier, but there are so many organizations. I mean, we've interviewed a lot of folks here in
Yeah.
Fullerton, right? Radiant Futures that works with folks that are experiencing domestic violence. Be Well OC, that's more about mental health.
Yeah.
You have Solidarity with so many resources that they have. You have Hoya Scholars that provides
Right.
tutoring for kids, among many other things, right? So
Yeah.
I could go on. It's a list of like 500
Sure.
organizations, right? How does Hope kind of bring those organizations in and the great work they're doing, whether it be about mental health or education or immigration services, the whole host? How does Hope kind of work with them to provide better services to the clients that you're serving?
Well, I think what's important to remember is that Hope has a very narrow mission.
Okay.
And so our mission is to try to reduce or end street homelessness. So in that regard, our first job is to try to have people responding to persons on the street
Right.
with outreach staff unless it's an emergency call. So for example, here in the city of Fullerton, the city of Fullerton employs what they call homeless liaison officers, people who have specialized training in dealing with folks on the street. But what the city of Fullerton, and I think most of the other cities in the Northern Spa prefer, is that if it's not an emergency call, and if it can be handled by paraprofessionals who are experienced in dealing with the population by means of getting them into shelters, they'd rather have outreach staff do that than a police officer engaging with them. Okay. It's just, A, it's less expensive, and B, it's a whole different set of training and organization that's required in order to get the person off the street. Now, if it's an emergency call where there's a risk to health or safety, either for the person themselves or for anyone else that may be interacting with them, there's always a case to make a priority to get a police officer or to get paramedics to a scene if it's an emergency. So what the Hope Center tries to do is to be the right resource in the right time in just the right way. So we're not replacing the police, we're just trying to take the pressure off them to respond to non-emergency calls. So our job is to respond to emergency calls for homelessness on the streets in North Orange County.
Gotcha.
So to that extent, to answer your question, we try to coordinate with people who are offering services to that population, but sometimes there's not like a one-for-one correlation about what we're doing and how we can coordinate with other nonprofits or community-based organizations. Although we do work with some more closely than others. But our real job is to try to get people off the street as quickly as possible.
Okay. So say we have, our average Fullertonians that have their jobs and that have their families and they have their whole host of responsibilities, right? But they still want to help out. They think this is a worthy cause and they want to help your center's cause. What are some ways that people who have otherwise busy lives, they can get involved and truly make an impact? What would you suggest to them?
Well, just because what we do is so technical and requires a ton of training, we don't have volunteers participating in our mobile outreach teams. It requires a lot of training with our software systems and learning how to embed with police officers, because we're trying to let the police officers, even when they go out on rides with us, we try to not let them have to be the lead. We try to be the lead. So our model doesn't really work well for volunteers who want to come in and provide services. So I would recommend that people who really want to make a difference, number one, become engaged with your local city council. Okay. And understand what your city's policies are with regards to homelessness, and try to support your council in whatever activities they're undertaking in order to address homelessness, and understand what those policies are. So that's one way to get involved. The other way to get involved is you just articulated a group of organizations who are doing fantastic work. And there's absolutely a tremendous need that all of those organizations have for assistance, either financially or with volunteer hands and feet. So I highly recommend find out who the best organizations in your community are that are doing great things with regards to direct service to people with food or assistance, and contribute your time and your financial resources to those groups. And if you're lacking, people can always call the Hope Center and ask for referrals themselves, or usually most cities know who the great organizations are and can provide you that guidance as well.
Okay. So to talk about Fullerton again specifically.
Sure.
Some folks here have the opinion that Fullerton has more people experiencing homelessness than other towns, specifically because we have quite a bit of organizations and programs, and that apparently attracts folks experiencing homelessness. So what do you think? Are these programs attracting more people to town, or is it just more programs just indicate more need?
Well, I think it's really hard to find good data on our programs serving the homeless persons experiencing homelessness, a really what we would call an attractive nuisance. There's not a lot of evidence that that's true. For example, if you look at the data that we have, just in 2024, there's not a huge change in the homeless population here in North Orange County. It's a fairly static group. There's some people coming in, and then there's some people exiting as housing units do become available and cities do build affordable housing, and people can leave a shelter or leave the street directly and go get housed. That happens, but it's really a very small percentage. And based on the data that we're looking at, we don't see a lot of people moving to North Orange County. Now, sometimes what you'll hear is that when other jurisdictions, like there's a lot of discussion about when the Olympics come to Los Angeles, there's a thought that that's going to put a lot of pressure on Los Angeles to enforce ending encampments and to try to get people moved into shelters. And if people aren't willing to accept any of the options in Los Angeles, obviously some of our cities butt right up against LA County. So there's a fear that some of those folks could come into our cities here because they're resisting the solutions that are being offered there. But I don't know that I have not seen any data that really supports that to a great degree. There's always a case where you can find people who are living here on the streets in North Orange County now who may have ties to other counties and other cities, but it's a relatively small number.
Okay. And the data that you're referring to, where can people find this kind of information? So you said earlier that on your website soon there will be an annual report that specifically speaks to the center. But when we're in general talking about homelessness in LA and OC, where can people find good, credible evidence and data of solutions that are working, other than just relying on that news article that pops up every once in a while?
Right. Well, I think if you're really going to be committed to finding evidence about programs that work, right, you need to get familiar with the internet because there's lots of research out there about what solutions have worked. Yeah. There's evidence that they do work, and that's across the country. So there's data from the University of Pennsylvania, for example. A researcher named Dennis Culhane has really done groundbreaking work on evidence-based solutions to homelessness. But if you want Orange County-based information, I recommend contacting the Office of Care Coordination at the County of Orange. A gentleman there runs that office named Douglas Becht.
Okay.
And Doug has all of the information throughout the county on rates of homelessness, growth in rates of homelessness, and just the most authoritative source of data I know of in Orange County about homeless solutions and what the data says.
Gotcha. All right, so that's definitely a resource that we will also be using in our reporting. Thank you.
Sure.
One more thing to just kind of follow up. You have said that there are good solutions that are work, say on a nationwide basis.
Yeah.
In an ideal world, you have a lot more money and more resources. What are you implementing in, Hope Center? In the ideal world, using some of this evidence and solutions that have worked to bring it to North Orange County and kind of solve the crisis here faster and in a more effective way?
Well, as we were talking earlier, I would say it's a multifaceted problem, so it requires multiple solutions. One of the great innovations I think the Hope Center brings is to try to remove police officers from responding to calls of people who are experiencing homelessness if it's not an emergency.
Yeah.
If it doesn't require police or public safety services, like that's a great innovation, is to get officers out of having to respond to those calls. Obviously, as we discussed earlier, you can't do that universally because you do need those responses. But you also need adequate shelter beds, and then you need adequate housing opportunities so that people who do get into a shelter have a place to go within a reasonable amount of time. So those are the solutions, I think, that are proven to work. Housing at the far end, interim shelter opportunities in the middle part, and then for people who cannot be prevented from losing their housing and going to the street, the key is getting them off the street as soon as possible. So that's where the Hope Center comes in, to that part of the continuum. And then we rely on having adequate interim solutions like shelter beds or transitional housing. And then, for people to exit those solutions, those situations, you need housing at the far end so that people can go back to living a sustainable life.
Right, and independently too.
And independently.
Yeah, okay, fantastic. So that brings me to my last question, in which I would like you to share, a success story that has happened in Hope that makes you, really hopeful about the work that you're doing.
Oh, it happens every day. Just yesterday. I don't know the gentleman's name, and I couldn't tell you if I did know.
Yeah.
But our staff got a call that someone was in need of assistance. So we went on the call. We couldn't find him.
Okay.
So the staff looked around, and just before they left, they thought they saw someone down an alley, right? So it's like they could have left because they'd gone, they'd searched, they'd looked. And just before they left, when they got back to the center, they told me the story. They found this gentleman down the alley who was really having tremendous physical problems. He was in a great deal of pain.
Okay.
So they called the paramedics. While they're there, the paramedics responded. Person was experiencing tremendous difficulties. The paramedics were able to transport him to St. Jude Hospital, and he was treated there. And I don't know his status as of today, but this was just yesterday. So I think, you think without that, both commitment on the part of the staff, people to do a thorough search to see if they could find the person that they got the phone call of, because it's quite frequently the case that you get a call and by the time you get there, the person's no longer in that place.
Yeah.
So the temptation is to then think, well, this wasn't a successful call.
Yeah.
But due to the persistence of the staff looking around, searching, looking, this person who was really ill and had hidden themselves, maybe not intentionally hidden themselves, but was hidden and not easy to observe. They found him, got him to a hospital, and who knows what would have happened to him had that not occurred. So that's a great example. I mean, I could go into others, especially when, the rare scarcity of housing opportunities for people you've worked with for a long time to get them off the streets into shelter, and then they get enrolled in a housing opportunity, and then they get that housing opportunity, and they just exit the whole system. Happens to us like every month, I would say. We have a few of those cases, and it really inspires you that people are the same no matter the experience that they're having. We're all humans, and even though we may look different, and those of us who have houses and homes have a hard time relating to people on the street. Not everyone, but some of us do. It's just so motivating when you realize that when you give a person the right opportunities and you work with them over a length of time, on their time and at their pace, everyone wants a home.
Absolutely.
Whether or not they're able to do that, given their current circumstances, ultimately what we see is tremendous success when you can just hang in there with people and give them that opportunity, even though it might not happen as on our timetable. Most people want the same things as we do.
Absolutely. Thank you. So I think that is the perfect quote really to end our interview on today, and to inspire people to, have more empathy, and, work towards making our cities, North Orange County, we're all Orange County, into a place where this crisis can someday, diminish or end someday. So thank you, George, for taking the time out for this interview today. Our team learned a lot today from you, and best of luck with your very important work at the Center.
Thank you very much. Thank you. Well, thanks for everything you do.